Hi, everyone. This is Dr. Tony Scuderi. Hope you're doing well. This is a Zoom presentation that I'd like to give you on adolescent treatment for substance abuse patients. Okay, and I'd also like to blend in their little co-occurring disorders along with it. Let's start a little bit about families, okay, and supportive systems within the environment. I think in my 34, 35 years of treating patients, some of them adolescents, one of the biggest problems I've seen deals with those two things, the environment and the family situation, okay? A lot of my patients in the past have come from very unsupportive or very abusive families. The children are not listened to, the children are beaten, yelled at. It's called toxic shock syndrome, where they're constantly told something negative, and then that gets built into their psyche, and as it's built into their psyche, they act out on it for later on in life or at the present time. A lot of them are neglected. Some of them have been thrown out and have been placed on the street and are streetwalkers and have found their way in the system away from that type of lifestyle and have sought psychotherapy and treatment and addictions treatment for their issues. That's one aspect of it. The next thing is peers. Some students have been bullied. Some patients have been bullied in grade school, high school even, and even sometimes in colleges we'll see a lot of things, racism, uh, sexism, that type of thing, where people are constantly hammered, told they're no good, they're not worthy, they're not worthwhile, whatever it may be. They're stupid, they're dumb, right? A lot of people have been told that. And when you tell that to a child, going back, when you tell that to a child, they're stupid, they're dumb, or there's an issue involved, something like that, that plays on them. And sometimes what happens is they take the feelings that they have because they don't know how to deal with them, and they'll bury them. It's called depression, suppress their feelings. Right? As this happens, the feelings that they have go away, and they can function in society. However, the question is, do the feelings really go away? Well, when we have repression, we have another thing called suppression, the continued burying of feelings. When this happens later on in life, they surface. They can surface in many different ways. They can surface in personal insecurities. This can lead to codependency. This can lead to anxiety disorders. This can lead to major depression disorders. Sometimes, if it's severe trauma enough, and they start to get something to soothe, what we call self-soothing, they try to soothe themselves, and they wind up going to substances to ease the pain from the mental torture that they've received. That's one aspect of it. Sometimes what winds up happening is the patients will turn around and they will start to abuse themselves. They'll start to act out. We'll see this sometimes in people that cut. We'll see this sometimes in people that use substances or sell substances. One of the reasons why some people sell, besides giving some money, they want to hurt other people. They've been hurt. And because they've been hurt, they want to act out. They want to hurt others to show themselves, hey, I've been hurt. Let me show you what's happened to me. This was one or two of the patients that I had in fentanyl crisis, where when I've talked to them, they were dealers. They basically sat there and they said, well, I sell because when I was a kid, I used to get beat up all the time. Nobody would listen to me, and it killed me. It hurt me. That's why I'm sitting here. So I really don't care. I'm going to strike out and I'm going to hurt somebody else to show society exactly what happens, right? From neglect, from abuse, things of that nature. So it's a very complex, traumatic situation that some people go through as addicts. And this happens in adolescence. Sometimes what winds up happening is during the transitions from childhood to adolescence. There's a lot of things that occur there, and we've all been through it, right? That stage in life where we need to become autonomous, right? versus the shame that we may have or the doubts that we may have, right? That should sound familiar. Autonomy versus shame and doubt, one of Erickson's stages, Eric Erickson's stages. So sometimes we're shamed as children, things that we do, things that we say from our caretakers or from those people that we see as caretakers. And then we start to doubt ourselves, we doubt our abilities, right? And as we start to doubt our abilities and we start to have that caretaker negativity play over and over again in our heads, this is called playing the tapes, right? The tapes get played over and over again. They get inundated in us, and we get to believe ourselves. We're not worthy. We're stupid, dumb. Nobody will love me. I am not lovable. I am not capable. And then what winds up happening is, the depression starts to set in, and nobody cares about us, about the depression, and are in so much pain. We need to do something. For an adolescent, that can be quite dramatic. That's one thing on gets them to use, right? That part. The other part comes in when you're an adolescent, you're transitioning over. You may not be one of the most popular people in the world, right, with your peers. So you're ridiculed. Sometimes you're beaten, you're bullied. For some people, that can be very traumatic and it can cause suicide, suicidal ideations. Suicide can come in many different ways. They can shoot themselves, stab themselves, overdose. We'll see that a lot of times, and people will sit there and say, "Well, what happened? He was a good kid. He did this. He did that. He loved life." Well, did he really love life? Because superficially, you could sit there and look like everything is wonderful. I can't tell you how many patients come in, and when I ask them, "So how are you doing? Could you tell me a little bit about your childhood?" It was a great childhood, really. Tell me a little bit about it. What was the relationship like with your mom and dad? How did they discipline you? Dad used to beat the crap out of me every once in a while, but I deserved it. You deserved it. Really? Well, when you start to say that, I start getting bells in my head. Because now, if you deserved it as a child, that says that you did something wrong. And as you get into adolescence and you're getting abused in the same way by your peers, are you thinking the same thing, that you did something wrong? Or is it that the way you were brought up and the way you look, and your peers are different, or you don't want to go along with your peers, so they start to abuse you. Now, sometimes the survival kicks in, right? Fright and flight, hypothalamic response. So you're afraid of this. So you either run from it using substances, or you fight. And sometimes when you fight, you win. Other times you lose. Okay. The winning part could be as dangerous as the losing part, because to win means sometimes they'll let you go, which is great, which is what you want. But sometimes the winning part means that you conform. And if you conform to those that are abusing you, then you yourself can become an abuser. And part of that conforming could be, to be accepted by your peers. And some of that acceptance by your peers is very, very negative in nature. For example, to be accepted by your peers, you got to come out and you got to drink, or you've got to come out and you got to use these drugs. You got to come out and you got to smoke if you want to be with us, right? Or you got to vape. And once you do that, you become part of that gang, part of that supportive peer group. At other times, if you remove the peer group for just a second and just become an individual, if you were brought up in an environment that wasn't very supportive, where your parents drank all the time, or when your parents fought with each other, or your caretakers, if something else was involved, they're fighting with each other, and you learn from childhood or adolescence, that's how you solve problems. You beat the person, or you yell at one another, and you withdraw, and you go to the liquor cabinet and have some booze, or whatever the case may be. That's what you're going to be trained to do. So when you're an adolescent and you have a problem, your problem solving skills aren't going to be systematic in nature. An understanding that once you have a problem and you solve the problem, it goes away. And then another problem comes up and you solve that systematically and that goes away and you learn how to solve problems. For the person that comes from an abusive environment, the problem solving issues may be that bottle. So when you're an adolescent, you go, let's say you go to high school and your peers or your teachers are pressuring you too much to do work or become, if you want friends, you're going to have to do X, Y, and Z. You turn to the bottle, you turn to the drugs, you turn to whatever, and you use. Okay. The other thing are the excuses. Adolescents are wonderful with excuses. Ask an adolescent that comes to you for substance abuse treatment when they're sober, what was the reason why you used? Could you tell me? And some of them, not all of them, some of them may sit there and say, well, yeah, I saw him use and man, he really looked crazy. And I really liked that. And I wanted to try to see if the same thing happens to me. Right. Or if they get drunk, oh, it was great. He looked so crazy at the party. I just wanted to do it. Well, what happened the next day? And they don't tell you about that, about throwing up in the toilet, right? They'll just sit there and say, oh, he looked great. And I wanted to look like that. The other thing that really astounded me were the ones that come up and I sit there and I say, well, why did you use? Didn't he die? Oh, yeah. But that drug dealer had better stuff than what I was getting. And I wanted to get that because I wanted to be as screwed up as he was. Boy, oh boy, that was really cool. Cool. He died. That says something as well. The other thing that comes into play is self-respect. If a person has respect for themselves, why would they want to use? Why would you need affirmation from somebody else? If you have respect for yourself, you have an understanding that good, bad, or indifferent, you accept yourself, you love yourself, you care for yourself. You don't know everything, and it's time for you to start looking for something to give you that information so that you go above to the next level. And what you're looking for is not substances, but that education from somebody. It could be a peer that's not using, that's pretty decent. It could be from a caretaker, could be from a pastor if you got a church or something. It could be from anybody, but it's not something that harms the person. But if you have a low self-esteem and a poor self-image, and there's so much pain inside you because of that, chances are that the substances are going to be your remedy for taking care of yourself. Okay. Sometimes it's cultural in nature, right? Sometimes maybe the culture dictates the feeling, the emotion, the problem. Okay. Rituals within a culture. For example, some cultures may use peyote to talk to their ancestors, to get hallucinations, and to listen to what their ancestors say, and come out of the high from the peyote, and then bring it back to the community and sit there and say, this is what the ancestors told me. All right, it can be ritualistic in nature. If that occurs, the question then comes in, what are they seeing? Does it help? Are they addicted to that stuff? How long has it gone on? What is the result to them? How often do they do it? Do they do it ritualistically or all the time? Not that one is better than the other. I mean, peyote is bad for you, period. I mean, causes psychotic condition in some people. The same thing happens with marijuana. The same thing happens with any type of substance. Right? But you got to look at it culturally. And then you have to work within that culture to find out exactly what's happening, why it's used, how it's used. Is it really necessary to use? Is there another way to get the same effect not using substances? Somebody's addicted to it. It could be that. Another thing, pain management. Adolescents sometimes, I mean, I know when I was an adolescent in high school, I did judo and still do, but I did judo, and you get off the mats, you're pretty sore, right? You go into a competition, you go to a tournament, you fight, you come out, you take a few bruises here and there, you're pretty sore. Um, if you're a beginner and you're starting, let's say age 13, 14, 12, 13, 14, somewhere around there, and you've never really exercised before, and you get out and you do that, your body after one night of workout is going to be kind of sore. What do you do to ease the physical pain? For some people that are smart, you take 2 aspirin, you soak yourself in a hot tub of salt water, and you go to sleep. Yeah, and you wake up the next morning in a little bit of pain, but not enough if you didn't do that. For some people, it's like, I'm in a lot of pain. I'm going to go to the medicine cabinet. Oh, there's a Percocet, I'm going to take it. And they self-medicate. And the next thing you know, they're high as a kite. They go to practice, go back, and they repeat the process, and then they reviews. A lot of things happen. Sometimes there are cultures out there that don't support a family system. So adolescents will have sex with one another, have children, and then the next thing you know, the father of those children is nowhere to be seen, nowhere to be found. So now you have a single mother raising a baby, and the mother is 11, 12, 13, 14, whatever it may be. Dad's not around. And that causes a tremendous amount of stress, especially if the parents of that young woman are not supportive or understanding. And I've seen a lot of that too, which is absolutely traumatic for that young woman. And sometimes the infant, the baby as well, becomes traumatized at that stage and continues and develops. There are many different things that happen in adolescent substance use. Okay, so look at the etiology of it. Look at where it comes from. Ask the questions. Ask the questions. How were you raised? What was that like? What was the reason why you used, other than you wanted to see your friends? If the effect of what you saw in your friends was the same, because there's always something underlying that. Okay. Did you use it to medicate anything like depression, anxiety, fears, to give you courage? Or was it something to give you acceptance? If it was something to give you acceptance, what is it about that you need it, that you can't accept within yourself? Ask these pertinent questions and then try to find a solution. Have your patients find a solution, on how they can do things differently. The substance gives them a particular feeling. And every substance is different. Every substance gives you a different feeling, right? That's the feeling that the person that's using the substance and abusing it is trying to get, because they're missing it. So you want to do as a therapist is you want to try to find out exactly how they can get that same feeling, not using the substances. Use motivational interviewing techniques if you have to ask the questions and draw that out of the patient. Because you can sit there and you can tell the patient, this is simple. All you got to do is this. And the patient will look at you and say, yeah, you're right. And they'll do it and they'll work for 2 times. And then after that, oh, I forgot. They forgot because they didn't claim it. If it doesn't come from within the patient, they may or may not follow through with it. The other thing with adolescence is, once you reach a certain age in life and you start to get peer support, you start to pull away from your home and go to independence, and you want to build your own integrity on who you are. Your parents are the stupidest things in the world. All right. I can't tell you how many adolescents I've heard say that. My parents just don't get me. I'm in love with this girl, or I'm in love with this guy, and I wanted to marry this person, wanted to have sex together. My parents told me she's bad for me, he's bad for me. They don't know what the hell they're talking about, or something else. And parents are the dumbest things. And the parents are like, don't know what to do. Or the kids are out of control because they have no boundaries. And part of that comes from their developmental years, when their parents weren't strict enough to give them the boundaries. I'm not talking abusive, I'm talking strict enough. Teach them right from wrong, and how to listen to authority and how to deal with authority, without being abusive. Okay. You don't teach listen to me by grabbing the kid when he does something wrong and beat him with an extension cord. You don't do that. You don't sit there when the kid doesn't do something and tie him up and throw him in a closet. You don't do that. Okay. That just causes a lot of animosity, a lot of hidden aggression, a lot of fear. And this is also one of the things in adolescence or even in childhood that'll cause somebody to use. You teach the child how to deal with reality and how to deal with their feelings and understand their feelings are okay, good, bad, or indifferent. It's their feelings. And you teach them how to deal with it. If you don't teach them how to deal with it, the outcome can be monstrous. And I do mean monstrous or deadly. Okay. You hear on the news a couple of weeks ago, I heard on the news, a teenager, good looking guy, and everybody liked him, was an athlete, was tops in his class and all this stuff, died from an overdose. And you sit there and parents are going, but he loved life. He was wonderful. He was this, he was that. And you wonder, why, what happened? And then the report continued and said that he had a little bit, there was something up with him physically. And he went online and bought a Percocet online and took the Percocet to take care of the pain. And it wound up to be laced with fentanyl, and that killed him. Why did he go online? What couldn't he tell his parents? Or did some peer tell him, oh, just go to this website and go get this medication because it's a painkiller, you're in pain, this will take care of it. So teaching somebody right from wrong, critical thinking, critical judgment is something that needs to be taught early childhood. And you do it gently, you do it firmly, you use a lot of examples, you allow the child to make mistakes, you show the child where they made mistakes, you show the child how to discern and how to decide so they don't make the mistake again, right? You show the child love, care, compassion. The child should grow up to be a little bit more responsible. Sometimes it doesn't work, right? Most times it does. So you have the patient in front of you, and they're in that stage, that adolescent stage of development. Adolescence goes from, I would say, from about 12 to 22. That's adolescence. Okay. Then you start to go into young adulthood from about 23 to maybe 30, and then adulthood from about 30 on up. That's my thinking from my years of experience working with these people, working with children, adolescents, adults. Okay. And each one of those stages is unique, and one builds on the other. What happened in childhood is going to happen in adolescence. What happens in adolescence is going to have an effect on young adulthood. What happens in young adulthood is going to have an effect on adulthood and the rest of your life. And this deals with almost everything. So these are very critical years. Take a look at some of the developmental psychologists, Piaget, Erickson, Carol Baumrind, all of these, the ones that are long gone and past and all that, the rudiments of the things that you study, even Freud in the stages of development, as wacky as that was in the psychosexual stages. But you look at all of them, compare their theories, look at their theories, see what stages the child is going through on up to adulthood, and then see the dysfunctions that happen within them. Once you begin to see that, then you can start to treat the adolescent. If an adolescent comes to you with substance abuse issues, just sitting there and saying, well, just don't use, go to a meeting, get a sponsor, pray a lot, go find a hobby, does not work. I'm sorry, does not work. Those are ancillary. They will work in ancillary if you need support, if you need guidance, but to take the substance in and of itself, they do not work. The person may need inpatient treatment, pharmacological treatment from a psychiatrist, may need psychological treatment, psychiatric treatment, especially if all of a sudden, when they take their drugs, the neurochemistry changes. Once you start to change the neurochemistry, all kinds of things can happen. They can become psychotic. They can become, anything in the DSM-5 and any type of diagnosis. They can start to have an anxiety disorder, ADD, whatever the case may be. Brain damage, yes, brain damage, schizophrenic, schizoaffective disorders, all of these, right? Then they start to develop personality disorders, and they are horrific if you're dealing with them. So it's not just simply get a support system and just don't use. You know, God bless Betty Ford when she sat there, back in the 60s and 70s and said, with her thing, we're going to have a campaign, just say no. Just say no doesn't work because nobody wants to say no to something that makes you feel good or feel the way that you feel. Even if they sit there and the whole idea was if you're approached, by a drug dealer to sit there and tell the drug dealer, no, I don't want it. Well, yes, definitely want to do that. And if that's the message, then that's where it starts. Then that's wonderful. But drug dealers are very convincing. And drug dealers are very good at what they do and how they do it. So just say no may or may not be an option. But you got to teach the people. You've got to teach the children. Show the children, show the adolescents what actually happens. Don't be afraid to show an adolescent a movie of somebody that overdosed and having the paramedics work on them or have them in the ER when a doc's got their chest split wide open because they had a heart attack and they need to do either bypass surgery or they need to do a transplant and the person dies on the table. That's scary, but at the same time, it gets the message across for some of those folks. Okay? Or show them a movie or a video about somebody that's a streetwalker and all of a sudden, there they are, they get accosted on the street, use drugs, somebody takes them and does something to them, beats them up in an alley or rapes them or something. The rape part you can, X out because you don't need to show that stuff. But, the idea is to show people that for every cause, there is an effect. If you use, there's something that happens. Teach them critical thinking skills. Okay. When you're treating an adolescent with a substance use disorder, don't be domineering or demanding. Listen to them because a lot of these children have not been listened to. Listen to them and don't try to treat them if they're high or stoned. You can't. Right? You can listen to them, but they need help. Get them to a psychiatrist, get them to a hospital, get them to a psychologist, get them somewhere because you are not qualified to treat that type of pathology. So don't try to do something outside your scope of practice. It's very dangerous and will get you in trouble. Look, assess, take a good history, take a good understanding, be kind, be cautious, be careful, look for trauma. Look for a very complex trauma. Look and see how the children are responding and have responded to what you're saying. Look for different signs and look for a way from the child using motivational interviewing on how to deal with that pain and refer. All right. So that's part of how to deal with adolescents when you're dealing with substance abuse treatment. I hope you got something out of this. Feel free to continue the research, and I wish you well. Take care for now.